I'm Jenny Cevallos, a fourth-year medical student, a member of Dr. Lebares' Resilience Lab at UCSF. I'd like to thank JACS for inviting us to present our work on operationalizing the culture of burnout and well-being, a study of value congruence in General Surgery Residency. Burnout in surgeons and trainees can lead to mental illness, attrition, and compromised patient care. We have few effective interventions to date, and almost none that address system and cultural level change. Value congruence is defined as the degree of alignment between worker and workplace values, a construct that lies at the intersection between individuals, systems, and cultural factors. In high reliability organizations characterized by maintaining high levels of safety, quality, and efficiency over an extended period, value congruence is a key component of job satisfaction. Occupational science has shown that an absence of value congruence in such organizations can degrade performance, increase turnover, lower morale, create conflict, and harm risk management and safety culture. Understanding how value congruence functions in surgical training may help inform effective and critically needed interventions in a new and potent way. To that end, we conducted a two-part mixed method study. In part one, we surveyed 300 surgical residents from 16 ACGME accredited programs to understand their perspectives on value congruence and well-being initiatives. We also conducted semi-structured interviews with 9 program directors exploring their views on well-being initiatives, existing interventions, and implementation challenges. In part two, we conducted a second survey with 251 residents evaluating the relationship between value congruence and flourishing, a measure of global well-being with evidence of validity in general surgery residents. Part one revealed a perceived lack of value congruence among residents relating to issues of inaccessibility, inconsiderateness, inauthenticity, and insufficiency regarding well-being resources. Interviews with program directors demonstrated variable awareness of and alignment with residents' perceptions. Put differently, program directors were largely aware of the issues residents raised, but expressed a different understanding of some. These differences stemmed from program directors' lived experience with independent practice and career longevity. Part two demonstrated a significant association between higher value congruence and flourishing. This study concludes with a compelling insight. Value congruence and perceived leadership authenticity are key cultural metrics for optimizing well-being in general surgery residency. Perceived lack of value congruence, despite its importance and emotional complexities, should not be misconstrued as a reflection of program directors' indifference or lack of awareness. This study calls for open dialogue as the initial step towards improvement and highlights the need for future work to identify where and how institutional actions diminish perceived value congruence. Potential high-yield actions at the system level include increased resident redundancy, shifting non-MD level work to advanced practice providers, and dedicated time for well-being as prophylaxis against burnout. Understanding where value congruence is lacking can serve as a blueprint for transformative changes in structure and culture of residency programs, marking a significant stride towards a healthier, more effective, and collaborative academic training environment. Thank you for your attention.